very warm welcome to the Rise interview. 60 minutes of big questions about the big stories from the news and beyond with fresh insight and critical analysis. I am Christian Ogodo. We're live in Nigeria's capital, Abuja. Coming up in the next hour, the United Nations chief has criticized the total lack of international coordination in tackling the COVID-19 pandemic and warns that the go-it-alone policy of many countries will not defeat the coronavirus. For analysis, would speak to a specialist in public health, disaster management, and clinical research in the United States. In the murky waters of politics, seeing through details is sometimes hopeless, but the travails of the opposition spokesman Ekwensi begs for attention. He's just been out of police detention after an FCTI court ordered his unconditional release from what it described as unlawful and illegal detention in disobedience of a lawful and subsisting order of the court. So, what led to his arrest? We'll speak to the man amid the storm. Ekwensi, coming up in a moment. And still on the fight against COVID-19, the United Nations Secretary General Antonio Guterres has criticized the lack of international coordination in tackling the COVID-19 pandemic. Mr. Guterres warns that the go-it-alone policy of many countries won't defeat the coronavirus.
We need is to make countries understand that acting in isolation, they are creating a situation that is getting out of control. We had waves that started in China, moved to Europe, moved to North America, now went to South America, to Africa, to India. Some people say that second waves can come at any moment, and there is a total lack of coordination among countries in the response to the COVID. At the same time, it is important to use that fact to make countries understand that bringing them together, putting together their capacities, not only in fighting the pandemic in a coordinated way, but in working together to have the treatments, the testing mechanisms, the vaccines, and to make them global public goods accessible to everybody, that this is the way to defeat the pandemic, as it is the way to defeat the pandemic, to coordinate political and economic and social responses, allowing for the impacts of the COVID-19. See more and more voices saying that, for instance, we need to have a vaccine as a people's vaccine, not a vaccine in a commercial dispute among countries to make the rich benefit from it and the poor not. So when I listen to the voices of the youth, when I listen to the voices of the civil society, I see there the seeds that hopefully will fructify in a much better coordination in the future of our response to pandemics like this one. So I am frustrated, of course, with the lack of international cooperation at the present moment, but I'm hopeful that the new generations will be able to make things change in the future. And I would really wish to see the global powers being able to come together and to lead the international community in a coherent response to the challenges of the times we are facing.
As the United Nations Secretary General there, Antonio Guterres, speaking on the COVID-19 pandemic and how the world is responding to it. Well, for more on this, let's cross live now to Tennessee, the United States, and speak to Dr. James Ekwensi, who is a specialist in public health management and clinical research. He's joining us via WebEx. Hello, Dr. James Ekwensi. Nice having you again on the Arise interview.
Thank you. I'm glad to be here.
Are you surprised that what you may want to call the disappointment or outburst of the Secretary General of the United Nations, a body of nations that's supposed to, that sees to the socio-economic and political well-being of the peoples of the world. But it seems highly disappointed the way the pandemic virus is being coordinated. It's like every man to his tent, God for us all. What are your thoughts here?
Actually, I'm not surprised that he's speaking out now. I think that it's been late. It's long overdue for WHO to speak out because there has been total lack of leadership. To fight something as big as this, a pandemic, requires a lot of collaboration and coordination and cooperation among the world leaders, and there has to be a leader. Normally and usually, United States always takes the lead in all these things, but there have been apparent lack of leadership. There have been failure to follow science, and there are voices coming out talking about things that can be supported, suggesting medications and things that really don't work. So I think that he's doing the right thing, and I think that the world should look at itself because pandemics have no respect for borders. If you're opening up in one country or one state and there is spike in another country, it's just a matter of time. The thing will still come back. There will be second waves and even third waves. So I'm really not surprised with him speaking out like that. Not usually there's a response plan. There's a global pandemic response plan that have been tried. Public health specialists and CDC and other agencies and global agencies, they know the plan. It's just that it's not been followed, and things have gone haywire because of lack of leadership.
Yes, this lack of leadership, some people think it's coming from the United States president and even the Chinese leader, you know, one accusing the other of not being truthful about the pathogen, its origin, and its deadly nature. What are your thoughts here on how to, you know, work in a cohesive manner that will help the world solve this pandemic in good time, just like the UN Secretary General was saying that countries should not go it alone approach? James?
I think the thing is that the world's been caught up with a trifecta of political, social, and economic problems, world class problems. And the sad part is that it's really been politicized. The because there's a presidential election coming up this year, politics has kind of entered it. But politics aside, what public health requires is the science, following the science. And what we have to do now is to allow people that know the stuff to do their job. It doesn't matter the source, it doesn't matter the origin, whether it's natural, intentional, accidental, it doesn't matter. What matters is that are we ready to deal with this? So the world has the resources. There is no doubt there are people, knowledgeable people that know the science, people that have the wherewithal to tackle these things. But the thing is that they've been shoved aside, and politics have taken reign. And until we push politics aside and know that it doesn't matter right now, it doesn't matter where it came from or whatever. What we should be doing is we should be applying the treaty strategy of testing, tracing, and treating these people. So that's what I want. What we should be doing now is let the people that know, that train, that practice for years in pandemic response do their job.
Okay, yes, in doing your job, and you as a public health management specialist, tell us, do you think this virus will go away very soon, or it's going to be with us for a very long time, despite the fact that countries that were first hit are already opening up?
Um, you can't say for sure because this is a novel virus, but going by the data that we are seeing now, even the places that are opening up now are seeing up spikes in and are more increase in the numbers of new cases. So I think that until there's a larger population, a huge population are exposed, or until we have a vaccine, this thing will still be around. But if we continue to do those social distancing, washing our hands, not putting our hands on our faces, all those things that been proved to work so far. The things that have been used to lower the cost, if we keep doing it, uh, the incidence will be negligible. We can still open up the economy and still manage it as we go. But if we just ignore the tested and trusted interventions that we've used, there will definitely be an up spike again, and there may be second or third wave.
Or third wave. Some countries really are experiencing that. Let's look at the cost of drugs, two that have been brought out, the dexamethasone and hydroxychloroquine. These are drugs that have been there for a long time and the rest. What the United Nations Secretary General is saying is that, look, let this, whatever medication or drug that is, found should be for the people and not commercialized. What are your thoughts along this line? Do you think the pharmaceutical companies, the research the institutions will not want to capitalize on the novelty of this virus and make these drugs very expensive?
The truth of the matter is that the drugs that you mentioned, chloroquine and dexamethasone, they are not actually, how do I say, they've not been proven to be that useful. The CDC kind of pulled out its support for the test for hydroxychloroquine, and dexamethasone is just a steroid that is anti-inflammatory. It's just to tackle the anti-inflammatory effects of the placement. And going by that, when health workers or professionals make those comments about how useful a particular medication is, the demand, people kind of rush and the demand, and so it affects the demand and supply of those medications. And once the demand, economic part of these medications go, the prices go up. But the truth of the matter is, until there's a definite, maybe antiviral medication that can actually either kill the virus or reduce its severity or its transmission, or until there's a vaccine, it won't actually work. But what I fear most is that when such vaccine or medication comes out,
Dr. James, sorry
Yeah.
to interrupt you here. You'd express those fears about the drugs. When we return after the commercial break, you're still watching the Arise interview. We've got plenty more still ahead. Stay with us. You're welcome back to the Arise interview with me, Christian Ogola. We're live in Nigeria's capital, Abuja. Let's cross over again to join our guest, Dr. James Ekwensi. He's a specialist in public health management and a researcher as well. We're joining via WebEx in Tennessee, the United States. James, before we went on break, you were trying to expatiate on your fears about so far the old drugs in existence that is just being used to manage the COVID. What are the fears that you have at the back of your mind as a public health specialist?
I was going to talk about the nationalistic approach of most countries, because as we know, these drugs are going to be developed and mass produced in these countries. And with the nationalistic approach that is going on, what the WHO man was talking about was that these medications, when is available, will not be available to developing countries. Let's put it like that, African and other developing countries, because all these countries, all they are planning for is for their own citizens. And that pandemic being what it is not the right approach. The right approach, it should be global, because as we know, pandemics respect no borders. So if you treat if you treat patients in your own country and they recover and all that, the disease will still track back to you if it exists in other places. So the plan should be to have these medications available globally. So my fear is that whenever the vaccines and the medications are available, they may not be available to developing countries. And developing countries should start making plans on how to either go through WHO or other means or develop their own medication, as the case may be. So that's my biggest fear. With regards to the other drugs you mentioned that are used in management, dexamethasone and chloroquine, they can be manufactured locally. Pharmacists in Nigeria and elsewhere manufacture dexamethasone and hydroxychloroquine, though they are not proven, but can be used generally.
Yes, indeed. So the medical researchers and medical experts and other scientists may want to believe. Yes, in Africa here, the CDC, together with the African Union, are collaborating in encouraging herbal or traditional production for a vaccine or whether syrup form against the pandemic virus. We know that Madagascar had championed one that is still subject of controversy and laboratory tests called COVID Organics. And in Nigeria, the NAFDAC is already testing some 10 claims by Nigerian practitioners, whether herbal or traditional medicines and the rest. What kind of funding, encouragement should be coming from governments in Africa when you talk of this nationalistic approach to treating this pandemic? James?
The thing is that government should provide funding. Alternative medicine, there's a role for it, but we have to be careful because we don't want people to take advantage of the desperate situation that we are in to sell things that don't work. Because the truth is that this disease, the case fatality is low. Most people that get it will actually recover. So even if you eat pawpaw or drink clove or take vitamin C or whatever, you may still recover. It's not those things that you did that actually cured you. It's just the natural history of the disease that most people will recover. So you see people making those claims that some concussion or whatever they do actually help them. So what we actually need is to subject those medications or herbs into good clinical research where you have a randomized control trials where if it works, it will be proven. But the WHO and CDC and the government, their role is to provide the infrastructure, the know-how to conduct these trials and get them on time.
Okay, in getting them on time, and let's stay in the United States where you are based there. We've seen that the cases in the US is spiking, is rising, and particularly with the protests going on all over America and even some parts of the world over the senseless killing of George Floyd, and the protest, no social distance is being kept. Majority of the protesters aren't putting on masks again. Aren't you worried that it will continue to spike?
I'm really worried because is part of that lack of leadership. Because part of the public health response to any pandemic is consistent messaging. You have to be consistent with your messaging. Now, people are not paying attention the way they paid attention before, and certain news and about the pandemic has been suppressed. You don't see a lot of those public health people coming to give daily updates the way they used to give. They figured out a way to suppress the reporting and the data because the actual reporting now is not actually what is going on. Because with the social things that are going on and the economic part, people have to earn a living. People are going out and they are feeling because they are not being messaged. The message is not passed on and is not consistent as should be. They are ignoring the things they are supposed to be. And some are believing, and there are conspiracy theories, believing that the pandemic is not even real. So all these things worry me a lot, and they worry a lot of public health experts because what we are looking at is spike. You can see it in states where they had all those mass demonstrations. There have been huge spike. Hospitals are seeing more people coming to their doors, and people are dying. So it's not a matter of wishing it away or thinking that it's gonna go away like that. No, you have to actually do what works. Follow the science, and this thing we can control it.
Yeah, if no doubt that the pandemic virus is quite deadly. I mean, particularly with people having underlying ailments and the rest. And the world thought that Africa would have become one big burial ground. But so far, do I say so good? The results coming out of Africa, even from Nigeria, which has the largest population, is still very minimal. What would you say could have made for this?
Yeah, as you know, epidemiology of diseases differ by geography, by time, and other factors. And there are so many things you can attribute that might have caused the transmission not to be that. One is the temperature. It's known that the coronavirus does not survive that much in very hot environments. And the other, that's why Trump, you remember, he said that they think that the transmission will reduce during the summer months. The other thing is that there's a possibility that the deaths and the incidence of the disease is being underreported in Africa because there are no testing. And another thing is that the genetic component of the people there could also explain why the epidemiology is different. So there are so many factors that play a role in disease transmission, which can explain why the epidemiology is different.
Okay, but pointing the way forward, I mean, some of the leaders have not been economical with their statements to the public, particularly the US president, who seems to be every day escalating the potency of the virus, the existence or non-existence, and the rest. Still going ahead with his campaign rallies. You don't think that that's quite a dangerous thing to be doing as well?
It is. Public health experts here in the United States advised against it. The state government, the local government, they all advised against it. But you have to face reality here. We are in an election year. The US presidential election is a couple of months away. And he is panicking. He wants to get reelected, and he feels he's already behind the polls. So he's going to do everything to put the best fit forward. And I sad that he's doing this thing at the risk of people getting sick. It is what it is, but the bottom line is that people should make the decisions for themselves. And I think a lot of people made that decision. As you saw, the arena wasn't that filled up. I know that some people may say it's because of the fear of the demonstration, but a lot of people are also afraid of their lives. We are in the middle of a pandemic here. So the bottom line is that the world has to change. Even politics itself, the way campaigns are run should be changed because of the pandemic that is going on. And politicians should listen to science. Leaders should listen to science. It's not because this thing is not just, it's about human life. People die when you make the wrong decision. And a lot of people, as at the last count, the United States, more than 120,000 people have died already. And we are not even up to a year in the pandemic. So where we will be in a year's time, it could be more than 200,000, 500,000. Nobody knows. So politicians should listen. Even in Nigeria, politicians should listen to the people that are trained to handle these things and base their policy and decisions on the advice of science.
Yeah, there's absolutely a conflict between science and politics, or leadership and scientific evidence to say that the pandemic is real. The pandemic is not going to go away very soon. The spiking, well, maybe the non-spiking of it in Africa, like you alluded, could be because of poor testing conditions and the rest. But so far, that's height been in Africa, low death rates and low infection rates. I want to thank you very warmly, Dr. James Ekwensi, as a public health specialist, management and researcher, has been speaking to us via WebEx from Tennessee, the United States. Nice having you on the show.
I'm blessed to be here. Thank you very much.